So welcome everyone. Very happy to have you here today for our afternoon session of the Global Health Policy Systems Research. So this is our researcher-led call webinar. We had one earlier this morning and this is our afternoon one as well. So that will provide a range of times. Just to make you aware, we will be sharing slides and recordings of today, and you will have some Q&As circulated as well, but we'll reiterate that later on. Next slide. So just to outline the housekeeping, all of the cameras and microphones are on mute or set to off. This is just to allow then the panelists to be able to talk and present uninterrupted. So we're recording the webinar. It will be made available on NIHR YouTube channel. Importantly, we do have a Q&A button, so add your questions during the course of the webinar. And if you could like questions that you would want to see the panelists answer today, then it'll just push the question higher up the list. If you have any connection or sound problems, then use the chat button for that. Next slide, please. So today our presenters, we're really pleased to be able to have Stephanie Russell from the Global Health Research Team at the Department of Health and Social Care. Also to have Dr. Sarah Puddicombe, who's our Assistant Director from Global Health Research at NIHR, and myself, I work in the Global Health Team. Also, we're having great support from our team, Abby and Asha, who have supported us this morning and this afternoon, so very much appreciated. Next slide. So I just want to cover the webinar agenda. The first area that we're going to look at, which Stephanie's going to focus around, is the Global Health Research Portfolio. And then we'll go on to look at Global Health Policy and Systems Research Programme, and specifically the researcher-led call. We'll be looking at eligibility and selection criteria. We'll consider the application process, hints and tips, also look at some finance guidance. And then at the end, we'll have panel questions and answer session. So next slide, please. So I'll just hand over now to Stephanie Russell.
Great, thanks very much, Tess. Yes, hello everyone. As Tess said, I'm Stephanie Russell. I'm the Portfolio Delivery Manager for the Department of Health and Social Care. So I'm going to not speak for too long today, but I'm going to talk about the background to the portfolio and set the scene for what the Health Policy and Systems Researcher-led call is all about, which Sarah and Tess will go on to say more about. So next slide, please, Abby. So first of all, I did just want to welcome everybody again. So fantastic to see so many people online from around the world with the interest in applying to this call. So again, we hope you find this interesting and helpful today. So first of all, the National Institute for Health Research, the NIHR's mission is to improve the health and wealth of nation through research, and it's the largest funder of applied health research and social care research in the UK. So you'll see on this slide, the dark blue circles represent the mission of the domestic programs, and then to the right you see the new addition, which is the Global Health Research Programme. So the NIHR funds research, the highest quality research that's been identified through commissioning processes such as the one you would go through should you apply to this call. We engage and involve patients, carers and the public, and in the global health setting, this is referred to as community engagement and involvement. We want to attract, train and support the best researchers, bringing in a pipeline and building pathways for the research leaders of the future. We want to invest in world-class infrastructure, deliver and a skilled delivery workforce, and really develop those strong health research system for the future. and we're strong on partnering with other funders, including charities and other funders of global health research. So you'll see that all of those principles are threaded through into the Global Health Research Programme, which was born in 2015 when the Department of Health and Social Care were allocated some of the UK aid budget. And so the Global Health Research Programme began. We're really pleased to be here 5 years later with this call. And I'll talk a little bit more about the other things that we invest in as well to set the scene today. Next slide, please, Abby. So here's a little bit about our aims, which are threefold. So we want to invest in applied health research that makes the unmet needs of communities in low and middle income countries, which is primarily and directly a benefit to them. We want to work collaboratively with global health partners to ensure cohesive and sustainable approaches to health challenges. And as I just said, we want to train, develop and connect future research leaders in global health research and to build research capacity. And all of those are aimed at delivering research that can be sustainable into the future. Next slide, please, Abby. So here we have our three work streams as a visual. So the portfolio consists of programs, partnerships and people. So the health policy and systems research is one of the programs, along with a number of others, which I'll highlight on the next slide. Partnerships we fund with other UK global health research partners and international funders such as Wellcome, the WHO. In the UK, it's with MRC, UKRI, and a number of others. You can see a full list on the website. And then we have the people work stream, which crosses the two. So we fund a number of researchers through programs such as this one, and also we work in partnership with other funders such as Wellcome through their fellowship scheme as an example. And we see that as overlapping the two strands of programs and partnerships. So on the left-hand side, you'll see the three principles underpinning the portfolio, which is that all research funded must meet the ODA compliance criteria, which you'll find in the guidance notes. We want to build on NIHR's principles of impact, excellence, effectiveness, inclusion and collaboration, again, all threaded through the guidance notes. And we want to strengthen research capacity through research partnerships. Next slide, please. Great, so you'll see here, this is, we've had a very busy year. This is a visual of the calls that have been running through the year through NIHR, through the programs. So we've had a units call, a groups call, Research for Innovation, Global Health Transformation, which is called the RIGHT calls, and Global Health Research Centres. So those have all closed now. So our last call for the year is this one, which is the researcher-led Global Health Policy and Systems Research call. So we're really keen to and excited to see the ideas for the research projects you want to put in your applications for. And Sarah and Tess are now going to go on and talk more about that process. But I did just want to finish by saying there's some uncertainty in the funding landscape at the moment that you'll be well aware of in the UK, and just to say that we are intending to fund research through this call. We've had a reduced budget ourselves, but this call has remained open and we fully intend to fund the highest quality research applications based on the available budget at the time. So it's over to you to put in those excellent research applications. Okay, thank you, Sarah. I will pass over to you now.
There's always an unmute moment on a webinar, and that was me. So thank you, Steph. And I'm just going to talk to you about the the Policy Health Systems Research Programme, and particularly our researcher-led call. Could I have the next slide? And a really warm welcome to all of you who have joined us today. So here's a very quick overview of our Global Health Policy and Systems Research Programme to date. And the programme was really set up to fund high quality research to improve whole health systems and health services in ODA eligible countries. And we've done that through a series of 3 different types of awards. Firstly, through development awards, which we have 17 funded back in March 20. And they were very much about set up partnership development, research planning awards, understanding needs assessment and undertaking stakeholder engagement to develop a substantive larger proposal for future calls, such as this researcher-led call. We then had our commissioned awards, and we funded 5 awards through that scheme, and they were really focused on particularly specific priority themes that we'd identified towards reaching universal health coverage and meeting the Sustainable Development Goal 3 of improving health and wellbeing in low middle income countries. Those awards were slightly larger. They were more sort of 4 years in length and up to about 4 million, so quite substantial awards. And previously, our awards were directed to LMIC, to both partnerships between UK and LMICs, but with contracting occurring via the UK institution. And a move now towards levelling the playing field in our new call is that actually, whilst the call is in open competition, we're inviting contracting institutions from either LMIC countries or the UK. So we're really trying to open up the opportunities to those based in LMICs. And what we're expecting is to have a research consortia, which would comprise of 5 institutions. That would be the 2 joint leads, and joint leads could be, as I've said, either 2 LMIC institutions, separate institutions, ideally in different locations, and or LMIC and UK partnerships. And then they could comprise of a further 3 additional co-applicant institutions from LMICs, although non-LMIC research institutions may also apply where justified. The awards will be for up to a duration of 4 years and up to a maximum of 4 million. And the typical range we're looking at is about between 1 million and 4, although we would be open to slightly lower cost applications where justified and proportionate to the research plans. We are, however, setting a maximum limit on the applications that each joint lead institution can make to this call, and there will be a limit of 2 applications in total per UK and per LMIC institution that would be leading. Next slide, please. So the aims of these particular researcher-led awards are to undertake applied health research that will definitively strengthen health policy, health services and systems, and ultimately lead to improved access to high quality, appropriate and affordable health services. And we're achieving that through a number of means. Firstly, through the production of high quality, contextually relevant research and the dissemination of those findings. And that research is focused on policy, services and whole health system strengthening, and ultimately will inform policy and practice in low middle income countries. And as Steph mentioned, we're really sort of encouraging the formation of equitable partnerships and networks between LMICs and LMICs in the UK to be able to generate new knowledge and evidence and sustainable research findings and capacity. We're expecting to see strong stakeholder engagement and community engagement and involvement throughout the research life cycle, from the identification of the priorities that need to be addressed through to the delivery and dissemination of those findings. And importantly, an aspect that we are really encouraging to see in addition to the research is capacity strengthening activities. And that could be both in terms of research, but also in research enabling activities and in knowledge sharing that can really help address needs and improve health outcomes in people based in low middle income countries. Next slide, please. So the scope of the call is very broad. We're really open to any area of applied health services and systems research that can strengthen and improve health systems for people based in low resource settings. And we can look at that, and we're interested in that at multiple levels. So either patient and practitioner, micro level, organisation and delivery of healthcare, the meso level, and at a more macro level through national health policies and systems. The applied research can also cover wider elements of health systems and shouldn't, but and can include but shouldn't be limited to things like governance, the financing, health workforce, information systems, the quality of services and service delivery. And we're very strongly encouraging the appropriate range of disciplines required to tackle research questions and needs which are relevant to low resource settings. So think about having that breadth of disciplines available within your team to really get the maximum out of the research proposal. Next slide, please. I'm going to move on to eligibility and the selection criteria. So if I could have the next slide. Now, this slide is about ODA eligibility, and it is critical that when you put in your application, you really must very clearly demonstrate how the proposal will meet key ODA funding requirements. So for instance, which country or countries on the OECD DAC list of eligible countries will directly benefit from the research that you're proposing, how the application will be both directly and primarily relevant to the development challenges in those countries, and how the outcomes of the research will really promote the health and welfare of people living in those countries on the DAC list. And if some elements of the research are not being undertaken in an ODA eligible country, then please do state clearly the reasons for this and how that research will benefit ODA eligible countries. Next slide, please. So I've already mentioned that we need to have 2 joint leads and that the research proposed must be of high quality and of direct and primary relevance to people living in LMICs. We need to see 2 joint lead applicants. These applicants would normally be principal investigators who are based either in a higher education institute or an eligible research institute, and one should be based either in an LMIC or the UK, or both can be based in LMICs. So where an institution is going to be contracting and is based in the UK, then we really require it as a mandatory step for them to jointly lead with an LMIC institution. So 2 LMICs can lead on an application either together or with a UK institution. But if the UK institution is the lead, then please ensure you have an LMIC as your joint lead. Next slide, please. This diagram is trying to clarify that position. And so you can see that we have 2 joint leads. And when we're talking about joint leads, there'll be institutions, but there will be a named joint lead, and each of those joint leads should have a suitable reputation and standing within their employing organisation and have demonstrable ability to lead a substantial large-scale programme of global health research. They will then link up with 2 co-applicants, a maximum of 3 co-applicants. And these co-applicants would be responsible for the day-to-day management and delivery of the project and will form a key part of the project team and the leadership within the research called consortium. Now, whilst we've got a limit within the core consortia, there is no limit to the number of additional collaborators that may interact and work with the project. And those collaborators would be those that provide specific expertise on particular aspects of the project, but wouldn't normally share responsibility for the delivery or leadership of that. And I just wanted to draw attention to the fact that in our systems, our online systems, if you are the contracting organisation, then your other joint lead and co-applicants will need to be invited by you in the system to accept their participation in the application. And as I have mentioned, that you can also involve non-LMIC co-applicants where that is well justified and where the expertise is not available within an LMIC partner. And when we talk about collaborators, we would expect some details on what your collaborators are doing and for that to be included within your detailed research plan. Can I have the next slide, please? We do have some limitations in terms of eligibility, and particularly in relation to submitting multiple applications. Now, as Steph had mentioned, we've had a number of calls recently. So if you have submitted any applications to the NHR Global Health Research Programme, please be aware that we won't accept the same or a substantially similar application that has been made to another call. So if you are submitting to us and you have submitted to other calls, please make sure your application is distinct and quite distinct and different to previous applications. And furthermore, we don't want to have an individual to be named as a joint lead on any more than one application across this call. And as I've mentioned before, for an institutional level, there is a limit of 2 applications in total per joint lead institution, whether that be UK or LMIC. Next slide, please. So this slide is really a summary of the key criteria that we're looking for when we're making a funding decision. So your application should cover all of these criteria and be really explicit and clear how they match them. So we're looking for the relevance of the proposed research, so how it's filling a significant gap and addresses an unmet need or priority identified in ODA eligible countries, and how it matches with the scope and the remit of the call. And we'd encourage you to ensure that your research plans are based on either a review of the local context and health system or a review of the existing evidence and research base. We're particularly keen on looking at research excellence, and by this, the high quality research proposal that is context specific and needs driven, and really has a focus on a significant policy, health system or service gap, and will be directly and primarily relevant to LMIC populations. We're also keen to understand that you've got a strong multidisciplinary team, that you've got the relevant expertise, and that you're promoting equitable partnerships within and across your research teams. And we very clearly want to see that equity and collaboration demonstrated when you're writing the aspects of your research proposal. When talking about capacity strengthening, please ensure that you've got some very clear plans for a focused programme of research, but also research management capacity development. So that might be at an individual or an institutional level, and it could include things like financial capacity management or other areas related to facilitating the research delivery. As I've said before about stakeholder and community engagement, we want to see that evidence throughout all stages of the research life cycle, and we'll have specific questions on community engagement involvement that we'll want you to demonstrate how you're addressing that and ensuring that the vulnerable populations' needs are being taken into account. In terms of impact and sustainability, please give us a sort of a clear strategy for how you see your pathways to impact, how you're going to promote research uptake and dissemination, and how you're going to then achieve the potential to improve practice, inform policy, and support implementation and the scalability of the research findings. And then lastly, what we're looking for is value for money. So please very clearly justify your budget, show us that it's representing good value for money, and that the expenditure is proportionate to the scale of the planned research activities, and that you've given consideration to the various 4 E's, such as economy, efficiency, effectiveness, and equity. Can I have the next slide, please? These are the selection criteria that the panel will use when judging your proposal. And that will include attainment of all the eligibility criteria and the key criteria for funding that have been met. So these are what I've just talked you through: the relevance, the excellence, the strength of the team, having equitable partnerships, strong capacity strengthening elements, good plans for community engagement and wider stakeholder involvement, such as policymakers, and clear plans for impact and long-term sustainability of the research, as well as demonstrating value for money. Now have the next slide. So this is just a summary of the types of things that we will support. So as I've just mentioned, proposals that are in remit and meet all of our eligibility and funding criteria will be considered. And what we're looking for is proposals for research that undertake whole systems approach and are based on findings from feasibility studies or other pilot data collection or previous research. But that's being tailored for the context in hand. We're also interested in applied health research to inform delivery of interventions at multiple levels. So that could be micro, meso or macro, as I've mentioned before, and that will relate to and affect wider elements of the low resource health system, which can cover anything from governance, financing, through to information systems, quality and service delivery. And this list isn't exhaustive, so please don't be hung up on things that we've missed out. Please do ensure that we've got multidisciplinary applied teams to be able to support a whole system approach to the research, and that it will tackle at least one and can indeed tackle more than one priority identified by LMICs. We're looking for proposals that will address issues of equity and that can incorporate research questions that may be involved around gender, age, and social barriers to health, and indeed economic impact. And we're open to proposals that consider the impact on wider health services of COVID-19, on wider health services and health systems resilience. And below is a link to the further guidance where you can get more details on what we will and will not support. Can I have the next slide, please? So this slide is to summarise what we will not support. And we are not keen to support proposals which really limit their focus very sort of down onto just the impact of, say, a specific single disease, such as COVID-19 on health systems. What we are looking for is a much broader whole systems approach that consider also capacity strengthening as well as interventions that can impact at multiple levels across the health system. So equally, we want to see proposals that deliver at national benefits with potential for scale up at a whole system level, or that have wider generalisability. So please don't just focus on limited proposals which don't have that potential for scale up or generalisability. We're looking for proposals that are not just requesting costs for the delivery of services and training for staff, which are not part of a wider plan for development and improvement of those services. So please make sure that any proposal is broad and encompassing as part of a wider research proposal. And if you're planning to evaluate a service or roll out of a new service in isolation, those will not be eligible. Please make sure that if any evaluation is involved, that it is part of an integrated research programme, and it's not just looking at an RCT in one area or undertaking some implementation science. So we do want comprehensive programmes of research that look across the system and wider determinants of health. And please avoid any research which just primarily focuses on developing new patient cohorts, biobanks or sample collections. And as I said before, there is more guidance here with the link below. Next slide. So I'm going to now hand over to Tess, who's going to talk you through some of the hints and tips around the application process. Thank you.
Thank you, Sarah. Okay, so the application process, we'll have the next slide, please. What we felt was having a researcher-led timeline is quite helpful, just to remind people that it's a single stage application process. Our call launched on the 12th of May 2021. And on the 23rd of June, that's our deadline for remit inquiries. So if you can just get that fixed in your calendar, But a couple of key deadlines are really around the 7th of July 2021, 1 p.m. Greenwich Mean Time +1. So this is the deadline for our mandatory intent to submit, which is very important. And also the actual application deadline itself on the 4th of August at 1 p.m. Greenwich Mean Time +1. Also, just to make you aware that our funding committee will be later in the year. It will be virtual funding committee on the 1st, 2nd, 3rd of December 2021. And that we'll be looking then for contracts to start on this call from May 2022. Next slide, please. So submitting an application, I know there'll be quite a number of researchers on the call who have used our MIS system in the past, and we're the first global health team to be running a new system, which is the Research Awards Lifecycle Management System. So this is replacing MIS, and you'll have to use this to submit your online intent to submit and your application online. So this is what it'll look like. We've got a visual there for you. So researchers who've used MIS in the past, you can use your existing email, and then if you just click on forgotten email, you can get a new one set up. So it'll be quite simple then for you to access the Realm system. Once you're in it, they are queries. If you have any queries, they can be submitted by raising a ticket via our Realm system. And also we do have a Realms user guide, which can be accessed through the Realms system. Now, I know a number of people will have used the MIS over the years. It is quite clunky, so we were quite excited to move to this new system, and it is more intuitive. So I think, although, you know, we're asking a lot with the new system and a call, I think you'll find once you're in it that it will be responsive. Next slide, please. So sources of guidance. So these are guidance that we feel will be important for you in support of your call, and with your application. So we've got the call remit and guidance. And this is focusing around the background, the rationale, the aims, the scope of the call, the eligibility, selection criteria, the process and the timetable. So this is quite important. The core guidance, we've got core guidance across all the centres now, and that covers team structure and partnerships, training and capacity strengthening, management and governance, risk management and assurance. We'll also outline around contracting, agreements and IP. Look at regulatory approvals, impact and dissemination, the reporting requirements, success criteria and barriers to the proposed work. Also, importantly, community engagement and involvement, and value for money. We have finance guidance as well, which is very much focused around ODA eligibility, about the types of organisations that can apply, about the direct and the indirect costs. It covers ineligibility costs and justification of costs as well. And then the final set is application form guidance. So this is going to outline the intent to submit, add in key application information, add in team details, scientific abstract, looks at plain English summary, detailed research plan, headers and guidance, also signatures and required uploads, which we'll cover later. So there's a Word version of the application form, and an Excel version of the global HPSR budget template. So that's available on our website, and the website links below. All applications must be submitted using the online application realms. Also, you may have noticed that we have developed a global health policy and systems research theory of change, which is now up on the website. So that's available with the website link there. So it is very worthwhile considering that when you're looking at theory of change. Next slide, please. So the intent to submit form. Applicants for the HPSR researcher-led call must submit an online mandatory intent to submit form, and that has to be via our new system, NIHR realm system. So the intent to submit form aids NIHR in the identification of peer reviewers for the applications. So just to make you aware, you won't be getting feedback on your intent to submit form, and no applications are rejected at this stage. So NIHR recognises the intent may not fully represent your final application, but what we wouldn't want to see is any substantial differences between your intent to submit and your final application. So around the research focus or around the joint leads. So the kind of things that it will cover is around lead and joint lead applicant details, administrative contact details, look at research team details and research location, also the plain English summary, which is the high-level description of the research. And also it will require estimated research costs. After submitting the intent to submit form, applicants should not wait for a formal response from NIHR and should continue to work on completing their full stage 2 application. Thank you. Can I have the next slide, please? So submitting your application, these are the required uploads. So you submit online via the Research Award Lifecycle Management System. And there's a link there so that I know there's quite a number of researchers already in the system and have started applications, so that's great. But there's the link for those that maybe haven't. And what we'll be looking for as required uploads are detailed research plan, a delivery chain risk map, Gantt chart and project management plan, and references. But we would want this limited to 2 pages. Next slide, please. So here we have a submission checklist, which is quite helpful to consider. Firstly, clear application that follows call guidance and including submission of the intent to submit. So give that one a tick. Eligibility met, and key criteria for funding are met. All uploads are included. So then you've got your 4 ticks in the boxes. What we would say is that if there are any uncertainties, then please do get in touch with us via our NIHR Global Health email. So many of you will have used that in the past, and there's a copy of it there. We will try and help you as much as we can. And finally, you must not forget to submit. Next slide, please. So what we're going to go on to now is some tips and some things to avoid within your application. So if we could have the next slide. So tips for applying. So when you think about the vision and the global health need, consider, is your program of research within the HPSR researcher-led remit, what knowledge gaps will be filled through this research? Clear health endpoints and patient benefit in LMICs, then thinking about the governance and project management. Think about what support will your contracting organisations provide? What percentage of lead applicants' time and wider resourcing is going to be needed for an effective project and financial management of the research collaboration? Think about, can the programme be delivered within the time frame, within budget, to get the achieved desired impact? And then think about partnerships and collaborations. How will you engage with potential partners and communities and develop your research plans? And what is the track record and strength of your interdisciplinary team? So just some areas for you to think about. Next slide, please. So also it's helpful to think about what to avoid. So just be careful not to be too ambitious, because the funding committee ultimately are looking at the application. They need to be convinced that the programme can be delivered within the time frame, but also within the budget. If you think you've got to consider the remit of the call, and if you miss any key elements of the remit, then that's automatically not going to be considered. So the kind of things that people have maybe forgotten before is not to have included a clear and implementable strategy for the pathways to impact, not considered what potential there is to improve practice or to inform policy, support implementation, and also about scalability. Having more partners than you need, this can make your programme more difficult to manage. Presenting a programme that's difficult to follow, or it might seem as being overly complex. A high percentage of the funds allocated to UK organisations is something to avoid, unless there's a real justification for this because of the nature of the research. And also avoid having a plain English summary that is just not in plain language. So maybe get someone else to review it, who maybe doesn't have a researcher's eyes, but actually would think about the plain English for you. Okay, the next slide. So we're just going to run through some finance and budget guidance. Next slide, please. So the available budget, as we said earlier, for each applicant is between 1 and 4 million maximum, up to 4 years. Sorry, I've just got an interruption there. I do apologise. The types of organisations and what costs organisations can claim. So UK-based organisations, HEIs, 80% of full economic costings, 80% of direct and indirect costs. NHS, 100% of direct costs only, no indirect costs. And then other costs, 100% of direct costs, 100% of indirect costs. Indirect costs should be calculated in proportion to staff effort. So then considering LMIC-based organisations, we would be looking at all LMIC organisations, 100% of direct costs, 100% of indirect costs. With indirect costs should be calculated in proportion to staff effort. And then high income country-based organisations, so for all, 100% of direct costs only and no indirect costs. Next slide, please. So some main points to note. All costs must be ODA eligible and should be costed using current prices, so no inflation included. Staff costs should be based on current salary and should include increments and employers' contribution towards pension, national insurance, and apprenticeship levy, but not inflation. Resources required to support monitoring, reporting, programme management, financial management, and assurance can be requested across all collaborating institutions. All costs must be in GB pounds. Exchange rates must be provided for all international organisations. Contingency will not be funded. Justification and breakdown must be provided for all costs. UK Higher Education Institute equipment, including laptops, are not normally supported. If requested, a comprehensive justification as to how the purchase will be of direct and principal benefit to the ELMIC community must be provided. Next slide. So we're just going to go over some training and development costs. So funding can be requested for full or partial formal training posts, training in technical research skills and personal development, institutional capacity strengthening, which includes financial, research, data management, legal and assurance training, and also coaching, mentoring, and peer mentorship. So the studentship costs, so this is for formal training, we'll just go through those. So students from ODA eligible countries who are registered to attend an ELMIC institution, NIHR will fund full studentship costs for stipends and for student fees. Moving on, students from ODA eligible countries who are registered to attend a high income country institution, NIHR will fund stipends. It's also expected that student fees are reduced to the level paid by the national students, and evidence must be provided of that. And then students from high income countries, student fees and stipend are not eligible for funding. Could we have the next slide, please? So just to give a more detail around the stipends, they can be claimed for students from ODA eligible countries, eligible for all academic training posts, where support or salary is not received from another source. Courses are expected to be for a minimum duration of 12 months. So courses undertaken in ODA eligible country HEIs and in non-UK high income country HEIs, then stipend in accordance with host institutions policy, and we would need a copy to be submitted to NIHR. If you were looking at distant or remote learning courses at UK HEIs, then a pro rata full stipend for the duration of the UK residential period may be paid. If you're looking at distant or remote learning courses at non-UK high-income country HEIs, then stipend as per host institution's policy, pro rata of full stipend for the duration of residential period may be paid And again, a copy of the policy would need to be submitted to NIHR. And then we'll just look at courses undertaken in UK HEIs. So the proposed NIHR minimum annual stipend is set at, for 2021-22, 15,560. And then you can see it goes up incrementally until 2026-27, well, it'll be at £17,012. And you will get these slides, so you'll be able to see that detail. Could we have the next slide, please? So just thinking about equipment, items purchased are to be used only for research, ODA eligible activities, during and after the end of the project. Equipment cannot be used for commercial purposes, and the equipment must be sustainable after the project end date. The equipment will also become the property of the partner or the contractor, and the equipment items for use in the UK will not be supported unless there's clear justification about how the purchase will be of direct and principal benefit to the ELMIC community. And then finally, the asset register must be kept, and this has to be reported on annually. Next slide, please. So for finance queries, please do get in touch with NIHR finance team. So we've got the contact detail below there. They're always incredibly helpful to teams to help them through the process and give additional guidance. So please do use them as appropriate. Next slide, please. So we're just going to move on to the next steps now. So the next slide is just some reminders and further opportunities. So global HPSR, the closing date. So just to remind you that for remit inquiries, that closes on the 23rd of June this year. The important deadline for mandatory intent to submit is the 7th of July 2021, 1 p.m. Greenwich Mean Time +1. And then, very importantly, the application deadline is the 4th of August 2021 at 1 p.m. Greenwich Mean Time +1. So a global HPSR common application queries document is going to be developed after the webinar, and will be made available on the NIHR website. Next slide, please. So this is just details around the website, email address for the general global health if you've got some queries or you want to have discuss anything further. And also we've got our Twitter there